My name is Dr. Rachel Garner. I am one of the OBGYN physicians at OBGYN Associates in Tupelo. There are a lot of things to consider, mainly just the health. Her overall health is probably the number one most important thing. Her weight is important. A good healthy weight is always a good starting point. She needs to examine her list of medications, make sure she's on a prenatal vitamin. There are some options for genetic screening, some tests that we can do before pregnancy to see if she carries any heritable genetic conditions, which could be useful for family planning. Other things we think about would be whether her vaccines are up to date, travel, considerations. Some places are not very good to travel to if you're about to get pregnant. So all those things are things that we consider. Well, the most obvious sign that might indicate that you're pregnant is the missed period. A lot of women complain of nausea, vomiting. Those are very common. Breast tenderness, some cramping maybe. All early signs of pregnancy. I would advise her to make the appointment as soon as she knows she's pregnant. We do our best to time the first visit at a certain point during the first trimester if we can, but the earlier you can call, the better, so that we can have some flexibility with scheduling. There are a lot of things that she can expect. The first visit is full of activities. There's a long interview process, really, where we investigate her medical history, and there's a physical exam component. We talk a lot about what to expect with the pregnancy and an overview, general health and wellness, and some lab work and an ultrasound all happen on that first visit, so lots to do. We generally consider an entire pregnancy to last 40 weeks, and so your due date will fall at 40 weeks exactly. If you're dividing that up into trimesters, we consider the first 14 weeks the first trimester, and then the third trimester starts around 28 weeks. And so we break up the prenatal care based on where you are in those weeks. During her pregnancy, we can divide up the visits in various ways just based on kind of the risk of the pregnancy itself. If mom is a low risk pregnancy, we would see her generally every 4 to 6 weeks in the first 2 trimesters. And then in the third trimester, we usually go to every 2 weeks generally. And then the last month of pregnancy, we'll see her weekly. We might see somebody more frequently if they're higher risk. Ideally, she should start a prenatal vitamin a month before conception. That's the best time to start your prenatal vitamin. All reproductive age women should be on a prenatal vitamin regardless. But during the pregnancy, I usually don't make a recommendation for one particular brand or anything. Over-the-counter prenatal vitamins are sufficient for me, as long as they contain enough folic acid, iron. Some people like DHA in their prenatal vitamin, but the main thing is just something that you're able to tolerate and keep down. Well, I would generally say, just a healthy assortment of fruits and vegetables and protein would be the most useful. I wouldn't specify necessarily a particular food, but whatever she likes and can eat and keep down and tolerate. But in general, I would avoid foods like that are empty calories, such as flour and sugar. I would say those are generally your enemies when you're trying to maintain a healthy diet in pregnancy. Yes, morning sickness is very common in pregnancy. We generally say that There are medications that can help. I would say the first thing that we would try would be maybe Unisom, doxylamine over the counter, and vitamin B6 are very useful and safe in pregnancy. Sometimes ginger-based foods and drinks can be helpful for pregnancy-associated nausea. The earlier, believe it or not, the earlier you start a prenatal vitamin before you're pregnant, sometimes that can help too. And, a lot of times we'll recommend small, frequent, bland foods in the first trimester, lots of hydration. A lot of times we'll say that, if you keep a pack of crackers beside your bed and munch on those first thing in the morning before your feet hit the floor, sometimes you'll ward off some early nausea in the daytime. But if those things don't work, you can call our office. There are some prescription medications that we call in very frequently for women, and a lot of tips and tricks that we can try. I would recommend no alcohol in pregnancy. There's not been an established safe amount of alcohol in pregnancy, so we recommend none at all. Avoid it completely. Smoking is unfortunately still very common in our society. I would suggest that you limit or stop the smoking during pregnancy. Yes, it can cause some complications with your pregnancy. We talk about very small babies, and stillbirth sometimes with smoking is increased in that setting. So it's best to stop smoking completely. Well, I would say no two women are the same and no two pregnancies are the same. So even within the same person, it's hard to predict how you will feel with your first trimester. But some women sail through the first trimester with not the first problem or symptom at all. And then other women have a lot of trouble with nausea, vomiting, and cramping, and lightheadedness and dizziness, and all kinds of undesirable feelings. But in general, I say it's impossible to grow a human without noticing. So all those are usually expected and manageable. So we can just see how it goes. The first trimester is probably the most crucial for the baby. Its organ systems are developing, and usually that happens by 10 weeks, where all of the organ systems have developed. So it's a very critical time during the pregnancy, especially with medication use and avoidance of infection, things like that. Mainly staying hydrated, I think, is the most important thing. The baby is very hardy and will take from her what it needs, regardless of how she feels. So it's maintaining her health and wellness that's so useful. It's easy to get dehydrated, especially due to all the nausea and vomiting. So I would say that's probably the most important thing, keeping that prenatal vitamin down, eating healthy fruits and vegetables, and keeping a balanced diet is useful. Well, usually the second trimester is probably the easiest part of pregnancy. Some women feel better in the second trimester than they do outside of pregnancy. Mainly, you will notice that your baby's growing and your belly is growing, and you'll have a baby bump overnight almost some days. You'll notice the first movements of the baby in the second trimester. You will start to look pregnant. A lot of women report a lot of lightheadedness or dizziness in the second trimester because their blood pressure is at its lowest point in the pregnancy. So we usually recommend lots of hydration to overcome that and increase your blood volume to compensate for that. But those feelings are temporary and usually get better. But the nausea is usually gone in the second trimester. I would say she probably has a lot more energy for exercise in the second trimester. That's important. Stay active during the pregnancy. So I would take advantage of feeling well in the second trimester and stay very active. But just more of the same, managing the symptoms of pregnancy, hydration. I would say she needs to get in about 150 minutes of aerobic exercise a week. So getting that heart rate to your target range for aerobic activity is important. But don't try to overexert. because then you can't sustain it for 150 minutes and get the benefits. So really anything you can do in the gym, you can do in pregnancy. I would avoid contact sports, obviously, and use your common sense. But running, biking, elliptical, swimming, all of those things are useful. I would exercise right up to the very end if you can. You'll find that it takes less effort to reach your target heart rate range when you're very pregnant. And so just keeping track of your heart rate to know how much exertion is required is the key. Well, at each visit you can expect something a little bit different, but most visits we're just checking in with her, making sure she's feeling well, especially in the early parts of the pregnancy. In the second half of pregnancy we start measuring for fetal growth. At each visit we either hear or see the baby's heartbeat, so we make sure the baby is doing well with an adequate heartbeat. In the second trimester, we'll do the glucose test to screen for gestational diabetes. At the very end of the pregnancy, in the last month, we'll start checking her cervix to see, if she's dilated any and progressing in that way. Yes, there is a lot to be concerned about with the flu and the flu season too. Flu season usually begins around September-ish. That's usually when we get our vaccines in, but we recommend that all pregnant women get the flu shot as soon as they can. That's very important to avoid people that are sick. A birth plan is a very personal thing, and it's the need for a birth plan is very different in different women. We try to be very flexible with somebody's birth plan. I do not expect my patients necessarily to bring a birth plan. For me, our plan is to have a baby and keep mom healthy and baby healthy and family happy. And I usually say how we do that is completely up to you. So if there is, in general, something that is important to you or that you will hang your hat on and be disappointed if it doesn't happen, it's always good to write that down and just let us all be aware, because when you are in the midst of labor, it's very hard to communicate those desires, and we want you to have a good experience. So whatever is important to you is important to us. So I would say whatever works for you. Well, there's so much to consider when you're trying to plan a family, but if you have any questions, please feel free to bring it to us. It's always good to sit down with your physician when you're considering pregnancy and discuss the implications in your health and whether pregnancy is a good fit, in general, for you and for the times during the pandemic. It's always something to consider.